Hello to everyone. Myself Varalakshmi K, nursing tutor ESCON. Today I discuss about the physiology of menstrual cycle. Introduction. Typically a woman of childbearing age or reproductive age 15 to 45 should menstruate every 28 days or so unless pregnant or in menopause. Numerous things can go wrong with the normal menstrual cycle. The menstrual cycle is essential for the production of ova and for the preparation of the uterus for the pregnancy. Definition. The periodic discharge of blood, mucus and uterine cellular debris at cyclic intervals from menarche to menopause. Exception: pregnancy, lactation and ovulation. Pharmacological intervention: example, contraceptive pills. Characteristics: menarche 18 to 16 years, duration 2 to 7 days, less than 2 days, 2 days in the sense hypomenorrhea, then more than 7 days in the sense menorrhea. 30 to 80 ml per day, uses 3 napkins per pads per day. Less than 30 ml hypomenorrhea, more than 80 ml menorrhea. Cyclic length 21 to 35 days, average 28 days. Content: normal menstrual blood does not coagulate as a result of the secretion of the fibrinolizing enzyme, that is plasmin is secreted by the endometrium, and that's why the normal menstrual bleeding does not coagulate. Menstrual malinuria refers to mild symptoms of the 7 to 10 days before menstruation, relieved once menstruation occurs. Exaggerated condition is called premenstrual syndrome. The hypothalamic pituitary ovarian axis, the phases of the MC and ovulation are regulated by the interaction between hypothalamus, anterior pituitary and the ovaries. The interaction involves hormones, endocrine glands hormones, hypothalamus, gonadotrophin or releasing hormone from the hypothalamus, follicle-stimulating hormone and luteinizing hormone from the anterior pituitary gland, then ovaries to produce the estrogen and the progesterone. Phases of menstrual cycle. There are two main components of menstrual cycle. The changes that happens in the ovaries is called ovarian cycle, and the variations that take place in the uterus is called uterine cycle. The ovarian cycle is divided into 3 phases. One is follicular phase, ovulatory phase and the luteal phase. The uterine cycle into 3 phases. One is menstrual phase, proliferative phase and the secretory phase. Components of the ovarian cycle: first one is follicular phase, next ovulatory phase, third one is the luteal phase. Follicular phase. Follicular phase begins with menses on first day of the menstrual cycle and ends with ovulation, day 1 to day 14 of the 28-day cycle. At the beginning of the menstrual cycle, GnRH, gonadotrophic releasing hormone, releasing from the hypothalamus, FSH and luteinizing hormone releasing from the anterior pituitary gland. FSH is responsible for the recruitment and growth of the several primordial follicle. Only one follicle on the one of the ovaries reach the maturity, that is the Graafian follicle, which secrete the estrogen. Increase the estrogen level causes negative feedback on the pituitary to stop the FSH. The uterine lining endometrium to grow thicker. Then move on to the ovulatory phase. The estrogen peak stimulates secretion of LH, leading to the LH peak, which leads to the follicle to burst open, releasing the matured ovum. A process is called ovulation. The remaining Graafian follicle forms the corpus luteum, that is called yellow body. Ovulation occurs on 14th day of your 28-day cycle. High estrogen also suppress the FSH secretion, so no further follicle growth. Then move on to the luteal phase. After ovulation, luteinizing hormone levels remain elevated and cause the remnants of the follicle to develop into a yellow body called a corpus luteum. In addition to producing the estrogen, the corpus luteum secretes a hormone called progesterone. When progesterone reaches the high level to inhibit the luteinizing secretion of LH, leads to the degeneration of the corpus luteum, that is fertilization does not take place. Then degeneration of the corpus luteum leads to decrease in estrogen and progesterone level and separation of the endometrium. Decrease in estrogen and progesterone level to stimulate the hypothalamus to secrete the GnRH. A new cycle is started. If fertilization and implantation occurs, placenta secretes a human chorionic gonadotrophic hormone, which stimulates and maintains the corpus luteum. HCG leads to positive urine pregnancy. Then move on to the uterine cycle. cycle. Components of uterine cycle is three. One is menstrual phase, another one is proliferative phase, third one is the secretive phase. Move on to the menstrual phase. First day of the menstrual cycle is marked by the onset of the menstruation. During the menstrual phase of the uterine cycle, the uterine lining is shed because low level of progesterone and estrogen. At the same time, a follicle is beginning to develop and start producing. The menstrual phase ends when the menstrual period stops on the approximately day 5. Proliferative phase, when estrogen levels are high enough, the endometrium begins to degenerate, and then estrogen stimulates blood vessels to develop. The blood vessels in turn bring nutrients and oxygens to the uterine lining, and it begins to grow and become thicker. The proliferative phase ends with ovulation on day of 14. Then move on to the secretory phase. After ovulation, the corpus luteum begins to produce progesterone. This hormone causes the uterine lining to become rich in nutrients for preparation for the pregnancy. The corpus luteum is the preparation for the pregnancy to provide nutrition to the baby for first few days. Estrogen levels also remain high, so the lining is maintained. If pregnancy does not occur, the corpus luteum gradually degenerates and the woman enters into the ischemic phase of the menstrual cycle, that is the secretory phase. Ischemic phase, on day of 27 and 28, estrogen and progesterone levels fall because the corpus luteum is no longer producing them. Without these hormones to maintain the blood vessel network, the uterine lining becomes the ischemic. When the lining starts slough, the woman has come full cycle and is once again at day 1 of the menstrual cycle. Thank you.